I'm Dr. Jillian Lucas Baker. I'm a professor, a wife, and a mom, and I've struggled with fertility issues.
I'm Sinora Joy Allwood, a holistic nurse, health coach, entrepreneur, wife, and mom. And I've also struggled with fertility issues.
Welcome to A Tribe Called Fertility. Part 2 of our discussion today, where we're going to take a deeper dive together in discussing implicit bias, weathering, and Black maternal health. So Tribe Called Fertility listeners, we are still with the amazing and brilliant Miss Stacey Stewart, and we're going to have a discussion about these very, very important issues. So some of the stats that I was looking at from your site were that women of color have up to a 50% rate of preterm birth as compared to white women. We know pregnancy-related deaths has more than doubled over the past 20 years. And the preterm birth rate has risen for the 5th year in a row. Something else that has also come to light, and this is kind of new data from the CDC, is that 24% of maternal deaths are happening 6 or more weeks after a woman gives birth. So they're not necessarily happening like right after the baby is delivered. They're oftentimes happening after the mother gets home. When we, say those stats out loud, like they still, anger me. Sometimes I'm in disbelief, but then I know it's the reality. So what are kind of the first things that come to your mind, Ms. Stewart, when, those stats are?
Well, what comes to my mind first is that for a country that spends as much money as we do on healthcare, we spend more money than almost any wealthy country does, and we get some of the worst results. Tells me that something is fundamentally broken. And if I ran a business where I spent more money on my product and had the worst product, I'd be out of business. So
that, if you put it like that,
that's
the truth. That's a fact.
So,
yes, absolutely.
So we need to put this model out of business and really start with a different kind of model that actually is more preventative in terms of poor outcomes, preventing maternal morbidity, maternal mortality, infant mortality, and premature birth, and really need to put more emphasis on the mother before she's pregnant, the woman before she's pregnant, and making sure that we're supporting that woman through her pregnancy journey, right? During pregnancy, at the time of childbirth, and even after. Because to your point, Dr. Baker, about a third of maternal deaths happen during pregnancy, about a third at about the time of childbirth, 1 week out from the time the baby is born. And then from 1 week after the baby is born out to 1 year, another third happen. So this is really a continuum that we have to provide support. And there are a lot of reasons for this, right? We got one of the biggest issues that we have around challenges with maternal mortality and morbidity have to relate to cardiovascular health. And that's why it's really important that women manage their health overall, especially their heart health, before they're pregnant, so that their issues don't really show up during pregnancy. We also have challenges with respect to not just our physical health, but our mental health. Like one of the big contributors to maternal morbidity and mortality in the postpartum phase really have to relate to our mental health and substance use and things like that. So we know that postpartum depression is a big issue. We know that mental health generally is a big issue. I'm not even going to get into how much these issues have been amplified in the midst of a pandemic.
Yes.
But frankly, we were facing a lot of this maternal health crisis before the pandemic even came. Now the pandemic is here, and we're starting to see, even more challenges, right? Which is a whole nother episode of a podcast.
Yes, we can have another.
It is.
Yes, we have another episode just on that. By itself.
But these are some of the things that I think about, and what I think about is what are some of the solutions, right? We've got, even when we look at infant mortality, it's really important, and we're about to be in the month of October. We're focusing on infant loss and the awareness around infant loss. We have issues around infant mortality that are not just tied to premature birth, which a lot of people don't really understand. In a lot of
Yeah.
communities of color, we've almost normalized premature birth. I mean, I say to people all the time, growing up, I don't know how many times I heard a woman say, "Oh, my baby came a little early," as if it's totally normal and totally
Normal.
fine, right? But
Yes.
what we know is that premature birth and the complications of premature birth are some of the leading causes of death for children between the ages of 0 and 5, one of the leading contributors to infant mortality. Of course, we have other issues around miscarriage and stillbirth, which affect many, many, many hundreds of thousands of women every single year. And we don't give enough, we don't talk about those issues enough because so many of them are so painful, but have to be talked about more so that we become more aware of them. But we shouldn't be normalizing these kinds of things and outcomes. We should be making sure that more people are aware of when these things happen. One of the things that we do at the March Times is we have a place on our website called Share Your Story. And we encourage women when they're able to, and when they can do so in a really safe and healthy way, to share their story of premature birth, or their story around miscarriage or stillbirth. Because the more and more we tell these stories, first of all, it can be healing to some women when they're ready to share those stories, but it can also be extremely healing to another woman who may not be ready to share her own story, but is comforted by the fact that she's not alone, right? That she knows that there are others that are experiencing this. But even more importantly, it gets us to a place where we talk about these issues and understand that really we should be doing everything possible to combat these kinds of poor outcomes when possible. That's why we're supporting the Support Through Loss Act, which has been introduced in Congress. It really looks at the issue of infant loss. It looks at the issue of funding more research to really understand some of the causes of miscarriage and stillbirth. It really, looks at ways in which we can support more women who are going through some of these issues, especially women of color, so that we can actually combat some of these things and actually improve maternal and infant health outcomes overall.
I was going to say that, Black women today are now becoming more fearful of becoming mothers. And, this is related to the staggering statistics related to Black maternal mortality. What role do you feel that race plays in medical interactions for Black women during pregnancy and post-pregnancy?
Well, unfortunately, it plays too big of a role because we have many women. At least 20% of Black women have even expressed that they have felt that there's been some racist interaction. Those are just the ones that report it, right? I mean, there's been some racist interaction with their healthcare provider. We know based on reports and studies that implicit bias is far too prevalent in our system. And those judgments are really often, the Black and brown women are often on the receiving end of what it feels like when someone has an implicit bias against them. That's not to say that Black and brown women are the only ones who are impacted by issues that show up in the healthcare system. Women in general, I think, are not often respected and valued in society as much as we need to have women respected and valued in society. But that's why it's even more important. We don't want to share what's going on and be as transparent as we can about where we are in the state of things, because if we don't shine a light on it, we won't change. When you start to shine a light on a problem is when things start to improve. If we weren't talking about maternal health, and especially Black maternal health, we wouldn't have a Black maternal health caucus. We wouldn't have a proposed $1 billion to fund solutions to this issue. I have 2 young daughters that are hopefully not ready to have children right now because they're only 18 and 16, but hopefully at some point they will. And I don't want any young woman to feel afraid to have a child. I want her to feel empowered to demand the respect that she deserves, to feel empowered to ask questions, to feel empowered to know where to seek help. And I want to make sure that our healthcare system and all of our systems and our policymakers are put on notice that we have a group of women who are informed and know what they should be have access to, and know what kind of treatment they should deserve, so that no woman has to enter the healthcare system for any purpose, especially if she's pregnant, and feel like she doesn't have the right for her voice and her body to be acknowledged and to be respected. That's what we're shooting for. So I hope the reverse is true. Not that we're scaring young women, but that we're empowering them
Right.
for their own rights. And that's what I'm hoping
Just
will come from
in
all of this.
shedding a light on
Yes.
what's happening. But yeah,
Yeah.
my daughter's 10, so I, pray that
Hopefully, got a long way to go.
we have right.
But
that we
now's the
will-
time we need to be laying the groundwork for this, right?
Right.
We need to be, why should we generation after generation, we're sitting here in 2021, how much longer are we going to sit and
and
tolerate
allow this
what has been going
to
on
happen.
for generations? I mean, when you look at
Yes.
the history of this country, when can you look at the Black women in this country? When have we ever had access to the highest quality, affordable healthcare in this country? It's never
haven't.
happened.
Right.
Well, now's the time to stop that. Now's the time to say no more, that we want access to the same level of healthcare, access to the same opportunity to have healthy babies as any other woman in this country. That's what we're here to do, right? So that's what we're here to try to accomplish. And when we'll be able to do it together, the March Dimes can't do it by ourselves either, but collectively, we believe that, and we feel very confident we can make a difference.
Can we talk briefly about the weathering framework, and maybe for our listeners who don't know what that is, and that's okay, because that's what we're here for. A topic that is talked about a lot. I've done research on this. I've wrote articles about this, and I've taught this in my class to my medical students when I talk about social determinants of health. Sinora and I have talked about this at length. We are working on a training for some medical residents at Rowan, and we're like, you all need to know what the weathering phenomena is, or what the weathering framework is, by Dr. Arlene Geronimus. But I guess for a lot of people, a mystery is that Black women who are more educated, who have higher income, we are the ones who suffer kind of the worst birth outcomes. And for a lot of people, it can be very confusing. And the people are like, well, that doesn't make any sense. And we're like, well, we know that doesn't make any sense, but this is what the literature shows kind of over and over again, and it's not getting any better. So yes, weathering and kind of how that plays out in this whole maternal health disparity world for Black women.
Well, Dr. Geronimus's work has been really created a breakthrough
right.
in terms of our understanding of the impact of racism.
Shout out to Dr. Geronimus. We want
Absolutely.
you on the phone, on the show.
Yes.
We love you.
Absolutely.
Yes, we love you.
Absolutely. And this idea that, a lot of people look at these outcomes around Black and brown women, and some people say, well, what's wrong with Black and brown women that they have this outcome? The fact of the matter is, there's nothing wrong with Black and brown women. We are not causing these poor outcomes for ourselves. It's not, and I have a good friend, Dr. Joy Perry, who says, Dr. Perry, who says, it's not race, it's racism that is causing this. And that's what Dr. Geronimus's work is all around. And the idea of maternal weathering, which was really in her research, she was able to see that over time, as women get older and as they become more adult, Black women, our birth outcomes actually decline. Whereas for white women, the reverse is true. They have worse outcomes when they're younger, and they get better as they get a little bit older, right? Through the childbearing age.
Yes.
And what that really speaks to is the fact that over time, the effects of what it feels like and what we have to experience as Black and brown women in this society is so, it diminishes our health to such an extent that not only are we less healthy, but our babies are less healthy as well. And that's really what maternal, this whole weathering concept is all about. And it does show up, Dr. Baker, in what you said, that a highly educated woman, Black woman, when you strip away issues of education, access to insurance, access to care, educational levels, income levels, all of those things, when you strip those all away, Black women are still 5 times more likely to die as a result of pregnancy and childbirth as compared to her white counterpart. A Black woman who is highly educated is far more likely to die as a result of pregnancy and childbirth than an uneducated white woman with less income. When you look at those issues, you have to understand that there is something deeply, wrong with the ways in which Black women experience and have a lived experience in this country that really affects our health overall. I know this personally from my own life experience, which is that, my father was a physician, and he dealt with a lot of women who were his patients, who suffered from diabetes and hypertension and obesity. And in fact, the majority of his patients had one or more of those chronic health challenges. But the number one thing that he diagnosed them with, in addition to those things, was anxiety. Wow. That it was the anxiety of their lived experience. And so when I was 14 years old, I had a deep understanding of the kind of stress and anxiety that Black women experience and how that played out in terms of really being a contributor to some of these poor health outcomes, chronic health conditions that far too many of us experience. So I think part of why we talk about the fact that if we're going to get to the bottom of this maternal infant health crisis, we do have to look at the social determinants. We have to look at our communities. We have to ensure that there is a level of support for women. We may not be able to change every single system of society around housing and in the environment and transportation and income and gender pay equities.
Every social determinative.
But we can start to make a difference to make sure that women, before they're pregnant, become aware of how to maintain good health and access to good health, the importance of good nutrition, the importance of not waiting until your 3rd trimester to see your healthcare provider for prenatal care, the importance of not making sure that the cost of prenatal care isn't cost prohibitive such that they cannot see a provider. We can start to make a difference on some of the things that we can change. Even if we can't change everything, let's look at what we can change. And that's what Momnibus is about. And that's what the work of the March on Dimes is about.
I mean, if you look at women like Mariah Carey, Serena Williams, Beyonce, Chrissy Teigen,
Alison Felix, Portia Williams.
Yes, Portia Williams.
Yeah.
We could go on and on.
The list goes on and on and on. It's like, it's hard to even find, unfortunately, it's hard to find a lot of women of color, especially, who don't have some kind of story. It's about fibroids.
We all have a story. That's the thing.
Yes.
That's another reason why we started the show. Like, we need to start telling our stories.
Exactly.
That's it. It's healing.
Let's shine the light. They're healing.
Yeah. Even me and Jill been friends since middle school, and we didn't talk to each other about our fertility journeys, our infertility.
Right.
We were suffering in silence, and we were dealing with a lot of shame. And we were like, my God, how many other women are dealing with this? And we just felt like that call to action to create that space, and
yes.
For me, just touching back on the weathering, I spoke briefly before about my experience. I sought prenatal care at 7 weeks pregnant, and I was seeing a doctor within a practice. Kind of sometimes it would rotate, but I would see pretty much the same doctor. She was white. And I remember going once, and she said to me, my husband always came to every appointment, and she says to him, you don't have to come to every appointment. Every appointment is not going to be eventful. You're not going to see the baby. And we just looked at each other and we're like, okay, would you say that to Susie and John? I don't know. But it was just like, I knew it wasn't right. She wouldn't even touch my belly. I remember being like 4 months, and I was so excited to see what was the height of my fundus, to see if the baby was growing correctly. And she's like, oh, I can look at it, I can eye it and see that everything's okay. And she would like put the jelly on my stomach and give me a paper towel and just wipe it. It would be cold, and all of this stuff I knew was wrong, but I weathered it up until 8 months pregnant. I had an accident, and a car accident. She forgot. Completely forgot.
And it didn't make Sinora automatically high risk after the car accident.
Nothing. She's like, oh, you went to the ER, you're fine.
Yeah.
And I was like, enough. And I was scared to death. because I was 8 months pregnant. I'm like, I have to find another provider, you know, and sure enough, I had an emergency C-section. Me and baby were both in trouble because she didn't do her due diligence. And with all of that being said, I just want to ask you, how does someone effectively advocate for themselves while heeding the advice of medical professionals?
Well, I think there are a couple of things. I think you in the moment, I think having your partner there with you is super important, because sometimes you may not be in a position to even advocate for yourself. If you're, for example, if you're in distress or something like that, or if you're just emotionally not able to do it, having a partner there. Your partner could be a family member, it could be a friend, it could be somebody, but having someone with you who can hear the same things you're hearing, not being alone is I think really important. But that's also why we really advocate for doulas and midwives, people that are trained in the birthing process, so they know what to look for. They may even know what questions to ask, because even a partner may not know all those things, but still it's better than being alone. So I would say to start with that. The other thing is that if you have a nurse or someone who's not answering your questions, demand someone else to be seen, or go somewhere else. Go.
Right. It's
That
okay
is your
Yes.
choice.
to leave and find somebody
Leave
else.
and find
Yes.
somebody else. Okay.
Yes.
If
Yes.
you have every right to get to a provider who you think is going to treat you with the respect that you deserve to be treated with. I mean, this is not something where you're not obligated to go to the provider that you happen to show up to. You just like everything else, go to the place where you're comfortable, go to the place that'll answer your questions. When you're looking for a provider, ask them, will I be able to ask questions? And will you be able to answer all the questions I have? And will you take the time to be with me until I feel satisfied? And if they are not willing to even spend the time on that, then you don't want to be
Right. That's
5
such
or
a
6
great
months
tip.
pregnant and feeling like, I don't know what's going on with my pregnancy. I don't know if this is the right thing, right? So, but the last thing I'll just say is that we have a system right now where it is up to each individual woman to advocate for herself, because there is no other, the system isn't set up to really receive that kind of self-advocacy in the way that we need. That's why we're saying this system can't be that way. It's got to be a system that has accountability built into it. It's got levels of support for women, right? Doulas, midwives, working with the birthing team in a hospital or a clinic or a birthing center. It's got to have culturally, congruent care. It's got to have ways in which to listen to women, irrespective of who they are and their background. It's got to recognize their cultural norms and how they think about childbirth and delivery. All those things are really important. And so again, the way we've invented this system is just not working well for the majority of us, and reimagining what it could look like to have a supportive, safe, healthy, nurturing environment for women to expand their families is what we need to envision. And we all need to work together on what that looks like.
Thank you, Ms. Stewart, so much
Yes. Thank you so much.
for
This is
being on the
awesome.
show. This
So
part
appreciate you
2
guys.
series. We hope that you will come back again. There are so many more things that we must discuss together that we didn't have enough time to get to on these episodes today. But you have to come back and we have to talk more. There's a lot more for all of us to talk about.
Love to do that. Well, thank you all for doing what you're doing. It's so important.
Oh.
Appreciate you being on. Yeah.
Ms. Stewart, could you please let our listeners know how they can find you and connect with you?
Okay. I want everybody to follow me on Instagram and Twitter, March of Dimes CEO. Woohoo! Also, go to the marchofdimes.org website to sign up to be an advocate. We have a whole campaign around blanket change that is in support of Momnibus, blanket change, Momnibus advocacy. Go to marchofdimes.org. You can also follow March of Dimes on every channel. I'm also on LinkedIn too, so you can find me there. Please follow and give me a shout out.
Thank you so much, Ms. Stewart.
Bye.
Bye. Thank you.
Please please make sure to follow A Tribe Called Fertility on Instagram, Facebook, and Twitter. Feel free to DM us with your questions and thoughts or to share your fertility story with us. For more information on your superb and beautiful podcast host, visit www.atribecalledfertility.com.
And if you're listening to us on Apple Podcasts, please rate and review us. It really helps the show, and we welcome all of your feedback.